So this is the new Planning Commission proposal. The government will only take care of small health services, things like immunization and antenatal care. For the other bigger services, it's going to be buying it from the private sector. Is the government putting its hands up on health? What does this mean for the poor of India? We have with us Dr. Vandana Prasad, public health expert, in the studio with us. Dr. Samir Kaul, oncologist with Apollo Hospital. He's also spokesperson for the PDP. Dr. Sambit Patra, surgeon. He's also spokesperson for the Delhi BJP. And Amarjit Kaur, National Secretary, CPI. Dr. Vandana Prasad, first of all, in very simple terms, what is the Sambit Patra? A lot of people have problems with this new government proposal, or rather Planning Commission proposal. What do you make of it?
It's a very sorry state of affair. In fact, it's an irony. The proposal by the Planning Commission is such that it appears as if the Planning Commission is an agent of the private and the corporate hospitals. Moreover, the irony is, in fact, the proposal in the 11th Plan Commission was...
One second, Dr. Bhatt, if I just interrupt you. I mean, why did you say that? Look, if for basic health services, you can go to a government clinic, but if the government is not able to provide the bigger things, the surgeries, or, more complicated stuff, is giving the patient, a poor patient, a choice to go to a private clinic under government insurance. What's wrong with that?
No, it's not as easy as that. As far as I have learned from the whole document, what the document proposes is that government would look after the most silliest of silly things. I mean, the smallest, though the silly things are not as silly as they're supposed to be. If they are really looked after, if the antenatal care is really looked after, if the immunization is really cared for, then the tertiary care naturally decreases. But the government is supposed to be just looking after the smallest tidbits, and most of the major care goes to the private sector. This is almost as if the government is shunning its own duty. Now, what the most ironical part in this is, in the 11th plan, we had proposed, in fact, the proposal was for 2.5% of the total GDP towards healthcare. But in the present 12th plan, what the proposal is right now is less than the 11th plan. How can we go in a retrospective manner? We are moving in a regressive manner. We are planning less than what we had proposed in the last section.
Let me get the view of Dr. Samir Kaul. What this basically means is that taxpayer money is going to be used to strengthen not the public health sector, but the private health sector. What do you make of this, Dr. Kaul?
Well, I think, to be very frank with you, my personal opinion is, I feel that for once,
on more of the public sector role in healthcare, as the government is now suggesting, or the Planning Commission is now proposing. Let's look at some other implications now. Now, if the government outsources healthcare more and more, what is the risk that it might increase unethical practices? Private doctors might be tempted to experiment more on poor, illiterate patients.
They're very true. In fact, Jujha,
is now proposing. Let's look at some other implications now. Now, if the government outsources healthcare more and more, what is the risk that it might increase unethical practices? Private doctors might be tempted to experiment more on poor, illiterate patients.
They're very true. In fact, Jujhar, before I answer your question, I was listening to the whole part of debate, and I just got reminded of one of the propositions that government has come out recently with. And the proposition is to distribute lakhs and lakhs of mobile phones to the poor people this 15th August. If you remember, and approximately 7,000 crore rupees has been promised by the central government to distribute these mobile phones. I don't understand the government can dole out such huge amounts of money for distributing mobile phones to the people living below poverty line, but the same amount of money cannot be doled out by the government as far as the life and the health of the people is concerned. This is really shameful. And yes, as far as unethical...
Perhaps they feel that a mobile phone will get them more votes than...
Exactly, that's what the government has been doing. Yes, that's what the government has been doing. Everything in this world cannot be equated with votes and should not be equated with votes. As far as unethical practices are concerned, so the newspapers are abundant with those. The hysterectomy is being performed on 12-year-old girls. Hysterectomy is being performed on people, giving them the idea that if they do not undergo hysterectomy, then they would develop cancer. So these are the kinds of unethical practices which today's newspaper...
And let me go to Dr. Samir Kaul. What is the risk? Here's another risk that even more doctors would be tempted to move from the public sector to the
Jujar,
private sector.
Lujar, let's get it straight.
Yeah.
This is not a paranoid political discussion. It is a technical discussion as to what... I think the government should help with the insurance. That's what I think.
Dr. Kaur is saying the government should help with the insurance.
Why not?
Yeah,
The government should monitor, the government should strategize, the government should have accreditation of quality, the government should have licensing, but the government should help with healthcare delivery.
But Dr.
It's a healthcare industry.
Dr. Vandana,
It is an
I
industry,
just wanted
whether
to
you
put
like
one
it or
point
not.
on the dais.
Yeah, but Dr. Vandana, as far as I understand, the government exists.
The government is free to monitor such an activity, and if it happens, close it down. But
Jujar, I would just like to come in.
How much have they succeeded in monitoring the private sector and regulating the private sector so
Why
far?
not?
Any
Nothing.
moves to regulate the private
Because they
sector have
never
only
made
come
an
up
effort.
with
Because
very,
they
very
never
hard
made-
resistance from the
because they never
IMA,
made a
from all
serious effort.
associations of doctors that
Because
I
they
know of.
never
They've
made a
resisted
serious
every
effort,
attempt to
madam.
regulate them.
Yeah, but
Because
Dr.
they made no serious effort, there are no
Dr. Sambit
accreditation
called-
councils.
Sir, I want to say that there is denial of directive principles in the Constitution. There is denial to the fundamental rights in the Constitution. The government is running away from the constitutional obligations, and this is how slowly and slowly this very country in 70s we had primary health centers, and those primary health centers started getting some help, and investment in health slowly and slowly later on started getting reduced, and now the primary health centers are also almost allowed to die. Only with movement of the health workers, something has come up, and little bit NRSN came, and now the government wants to say we cannot do. It's 120 crore people, every 6% is in India in the world, and the government says they can't do anything for health. We
Dr.
don't
Samir
believe-
Kaul,
we
Dr.
don't
Samir
believe-
Kaul, I'll give you one example, because we're talking about, you were saying that the government can't do everything, the private sector has to be involved in health as well, but, given the current insurance policy, let's give an example. There's a poor diabetes patient, but when he goes to get insulin as an outpatient, he's not covered under insurance.
But for gangrene of his
when
foot.
the diabetes becomes so bad that he gets gangrene on his foot and that has to be amputated, then the government insurance will come into play. Doesn't that sound ridiculous?
Yeah, but you need to ask this question to the people who are saying that the entire healthcare delivery, no matter how complicated, should be done by the government. It can't be done. This is very idealistic, but it cannot
Why can't it be
It's
done?
not possible.
Please
My
consider
question is,
Tamil
why can't it
Nadu
be done?
as a state of this country.
Yeah, what's the experience of Tamil Nadu?
Please
What,
consider.
then what stopped the government from
We're just talking in the
deduplicating
air,
that model?
and I think we're all talking together.
It's being done in America, in Europe, in Scandinavia countries. How it is being done, I want to ask. In America, countries whose economy is much poorer than India, how they are able to manage.
Consider Sri Lanka.
Yeah, I think Dr. Vandana Prasad wants to give an example of the Tamil Nadu case
See,
here.
we can take the example of Tamil Nadu, which is a state in our own country. We can take the example of a neighboring poor country, which is
HRM being touted as something that has been universally successful, because it has not been, and the amount of scams that came out, I am not sure whether the
No
neighboring
shortage of
countries that I'm
scams.
giving as an
No shortage of
example,
scams in the
Sri
private
Lanka
sector.
and all have the same kind of scams in their government schools.
Rather, we think government wants to give away its responsibility and have the schemes like NRSN. And later on say there are scams, we will stop this also. Tomorrow they will say we will stop Manrega also. Scams are there at the top level, including in 2G spectrum, or in other scam or other things.
Dr. Samir called that there's scams in the private sector also.
Yes, but I'm not sure whether you have them in the neighboring countries.
Dr. Samir called, there's just been scams in a couple of banks. You remember what happened with Satyam Computers? There's scams
My
in the
friend,
private
I'm
sector as
saying,
well.
the High
I'm
Court
saying
has just made
that is
injunctions
what the
against
role
private
of the
hospitals
government
not
is,
fulfilling
to
their,
make sure that these scams
responsibilities.
don't happen. That is what they should strategize, they should facilitate, they should help, they should monitor, they should accredit it, they should do and provide insurance. The government has a huge role to enable people to access quality health care. That's what they should be doing most of the time.
Let's go
And
to
the
Dr.
fundamental
Sambit
right.
Patra. Let's go to Dr. Sambit Patra, Dr. Sambit Patra. Dr. Sambit Patra.
Jujhar. In fact, we have missed out on one point in the whole discussion.
Yeah, go ahead.
And if we carefully go through the draft, we would also find that as far as the financial typicalities are concerned, it has been mentioned in the draft that most of the finances, more than 50% of the finances would be provided by the state government and less than that would be provided by the central government. How is it possible that the fund insufficient state government would pay more than the central government, which already has the requisite number of funds as far as
the central government is only spending 1% of the GDP anyway, which is very, very poor. I mean, you know, who'd like to answer the question?
Jujhar,
Yeah.
I want to say, it is in a way, if you really want to finish a health system, then this kind of proposal which is there, as Dr. Patra just now pointed out, that throwing 50%.
We're in the last 1.5 minutes. Quick words now, Dr. Patra.
Single sentence. See, the government is busy privatizing almost everything. We just saw the northern grid and the eastern grid collapse a few days ago, and privatization and overdrawing by the private discoms. We, in fact, in Delhi are facing a privatization of water also. Now the country talks about the privatization of the health sector. Why is there any government at all? If everything is going to be private, what the government is going to do? Only mega scams. That is all. Nothing else.
Okay, Dr. Samir Kaul, final word from you. Go ahead.
No, I think that as a proposition that the government, so that the fundamental right of every Indian is restored, that he or she can access excellent health care no matter where, and they should have a choice whether they...
I would like to say one sentence.
Yeah.
I would like to say, if the Dr. Patra is saying that no privatization of health, I would want his party to take position inside Parliament, no commercialization and privatization of health sector, which is health and education, which is the domain of the government. Of course, the private sector side by side is running. So I would want it, if all the parties come together on this issue, which is an issue important for all citizens. I will ask him.
So you're asking Dr. Patra to go back to his high command in the BJP and have a vote with them.
Our party, Jujhar, is committed for the upliftment and for the health of the people. That's for sure.
Okay. Final word now to Dr. P against the Planning Commission proposal to outsource most, except for the basic health services, to the private sector. Well, of course, all we can say is that right now it's only a Planning Commission proposal. The government has yet to accept it. We'll see what happens in the days and weeks ahead. But in the meantime, Dr. Vandana Prasad, Dr. Samir Kaul, Dr. Sambit Patra and Amarjit Kaur, thank you very much for joining us. Thank you for watching. Bye for now.
Thank you.